Okay.
Take it away.
We are in a Zen booth.
Very zen, very, very comfortable.
See, I don't even have to ask the question, and you already answer.
I know that. That's really the Yoda in me. Zen.
Awesome, and that's definitely something that you are known for. So, yeah, it's true. It's
Okay,
true.
I'll take it. I'll take it.
Yeah, I mean, you always have this very grounded, calming presence.
Oh, that's a real blessing, a compliment. Maybe it's the white in my beard.
Maybe.
Now, we were last together in Israel, in Tel Aviv, at a big conference, this whole French-Israel Innovation Conference.
Yeah, true.
And now here we are in Las Vegas.
Exactly. What's your kind of after 3-day mind process? What did anything stuck with you? What are you currently thinking about when it comes to digital health and what was presented at health?
I think there's been a few really big sea changes since our last meetings here. One of them, everybody was talking about with exuberance or perhaps over exuberance investment in digital health and how digital health would change the world. Now I think what we're finding is, one, digital health is health. We're just defining the digital aspect of it. But the other aspect is almost all institutions here, and we have hospital systems, we have payer systems, we have health information systems, you name it, all of them are recognizing that digital is really integrated into their system. Mm-hmm. It is. So that's one aspect. The other aspect I think is really clear is we're not talking about the distant future any longer. I think people are talking about, like, what will we do with digital and digital health next week? And I think that's very grounded. I think when we were talking about the future, it's, as a great philosopher in the United States once said, Yogi Berra, he said, the future ain't what it used to be. And the challenge with future is we're never really quite there. We're never really applying it. I think what we're seeing right now is that people are talking about practical stuff that they think they could put to good use, and stuff that they think will improve either their system or patient care right now. Mm-hmm. And I think that's a blessing to the discipline.
Do you think that's partially also because of the way that this year and generative AI discussions have accelerated the pace of change? And I think everybody agrees that this is going to have a groundbreaking impact on healthcare. It's not going to be potentially as fast as we might think.
I'm going to change the language a little bit because I see it differently.
Okay.
I think augmented intelligence, artificial intelligence, whatever we want to call it, AI, has been around for a while. We called it first big data, then we were using the term machine learning. I think what makes AI so exciting is it goes back to what I just said. It's the practical application of information for the now. So if we look at the tools like OpenAI, which everybody's been screaming about good and bad, what makes it so threatening is that people can use it right now. AI has become consumerized. And because it's become consumerized, suddenly we understand its greatest potential. AI is going to have its place in different ways in different systems. So for instance, I think we have to be fearful, and we should be fearful, the situation that happened with one major payer where they were using AI to boldly reject people's claims. In many cases, no physician ever saw the request for care. They were using an AI model to say universally no. That organization, I won't mention their name, you can look it up, begins with a C. That organization made a bold move afterward and said we're moving away from rejection of claims because they were really so burnt by that. So that's AI in the payer system, and I think it has to be watched. But AI in the medical system and the patient care system, I think it has to be accelerated. I think AI in terms of helping doctors look at zebra-like patients, young people with rare diseases where they can't really figure out what is going on. I think AI could play a major role in helping those clinicians collect all the symptomatology and all the data and put it together and come up with a diagnosis that may really improve that person's life. That's AI in the positive sense today. AI in the patient information sense, I think we're going to find a lot of patients who are seeing multiple clinicians for a GI reason, or a neurologist for perhaps a migraine, or they have joint pains. They're going to put that data into the AI beaker, stir it up, and come out with possibilities. So I think AI is a tool for now that will improve the physician's life and the patient's life. There's one area here I'm kind of disappointed it's not being discussed.
Which
I'm
one?
not sure what it is. You know, you and I have traveled these paths and we've seen a lot of conversation on interoperability. And interoperability is almost, not quite, but almost absent from the conversation right now. 2 years ago, it was everything. Now it's almost not mentioned. Now, it's not that we are never going to succeed with interoperability. It's just that we haven't had a tool as powerful as AI to actually make sense of electronic medical records. And I would say that as important as they are right now, many health professionals say to me, I don't have time to read the record. So what good is collecting massive amounts of data on you and me if our health professionals can't do anything with it? AI, particularly ChatGPT, could have the possibility of asking the records before a patient appears in the office and saying, could you tell me in 2 pages everything I really must know about that person? And that's not being discussed at this meeting. And
Oh, but it was. It was.
Okay.
I saw it. I saw
Okay,
it.
you
Yeah,
said
yeah,
you're
yeah.
proving me wrong. I can't be out of line.
Exactly. Yeah, that was discussed on one session, and basically that the thing that you said about doctors not having the time was
Okay.
basically the quote that I liked most. And it's important for every healthcare IT professional to know that doctors don't look at other doctors' notes; they barely look at their own notes. So yeah, we're definitely going to
Absolutely.
see a lot of potential here. You know what I liked? I kind of always also am interested in broader societal changes and impact. So like the 2 things that I kind of find fascinating in the US, and I don't see that in Europe yet, is all the discussion happening about food as medicine and around all the businesses that are being developed to prepare diet plans and diet meals for specific conditions. That's one. And the other one is the loneliness pandemic and how
Yes.
we're basically using technology to connect maybe people that have just been retired to then provide care to those that don't have family near them.
Well,
needs
the mental health aspect of loneliness, particularly we talked about old people, and I know the UK has really developed a massive system to address that using volunteers and older people speaking with even older people, matching them up, sort of like almost a dating system among older people, which is brilliant. But actually in COVID, we saw a tremendous amount of stress on younger people and even terrible suicidality among younger people who really felt great despair. So you're spot on. That's really a mental health need that we need, in a way, low-tech solutions. You know, zooming in or calling someone and checking in is not very complicated, but it needs process, it needs system. The food aspect of this, which is sort of like personalized medicine around food, is brilliant. At Health This Time, it's one of the first times I've seen significant elements of the pavilion dedicated toward food delivery service, like Instacart, for instance, which is very well known here. The concept of delivering food to your home is fantastic. And what I was also along that line thrilled to learn, I spoke to a lot of those sort of exhibitors here, is that they have a strategy for dealing with people who really need nutritious food the most. Sometimes it's the people who are really struggling economically, who don't have access to better food or good food. That's where the problem lies. They say sometimes in this country, unlike Europe, we have a large Medicaid population, people who fall below the poverty line. And those people often are eating fast food, which only contributes to the conditions that they're suffering from. So the concept of food as medicine is brilliant. I only hope that we move to a more progressive stage where government agencies that have been restrictive with food stamps now understand that by restricting access to food that they can afford, they're actually encouraging spend in a different area, which is something you and I care deeply about. Obviously, we want to prevent sickness. So you're absolutely right on that. Those are great finds about this meeting.
Mm-hmm. There was also a lot of very healthy food here. I must say that all Europeans missed desserts, but yeah,
Yes, I didn't see that, by the way.
No,
Although
no.
I
I really searched for them. I was like super happy when I saw a cookie today.
just for your followers, I want to say that they had a beautiful, beautiful snack of tuna poke salad available today. So obviously, health cares about our well-being and our appetites. But I haven't seen the cookies yet. I'm sorry.
Thanks, Gil.
Thank you.